John Bodkin Adams, born on January 21, 1899, and passed away on July 4, 1983, was a British doctor who was found guilty of fraud and was also suspected of being a serial killer. During the period from 1946 to 1956, a total of 163 of his patients died while in comas, which raised suspicions and prompted an investigation. Furthermore, out of 310 patients, 132 had included Adams in their wills, leaving him money or possessions. General practitioner, BTEAHEE, or family for those outside the UK. A physician is a healthcare professional in the medical field who attends to patients of all ages, providing comprehensive care for both acute and chronic illnesses. Their responsibilities extend beyond specific medical specialties, and they possess expertise in managing individuals with various health conditions. GP are trained to address a range of complexities in patient care, although the specific scope may differ across countries. In the United States, the term primary care physician is commonly used to refer to this role. The life of Dr. John Bodkin Adams is a controversial one, as he was never convicted of murder or professional negligence. However, even after his death, there are conflicting opinions about whether he was guilty of murder or simply performing mercy killings. Some compare him to the notorious medical mass murderer Dr. Harold Shipman, while others believe he was providing relief to terminally ill patients using painkillers. Dr. John Bodkin Adams practiced as a general practitioner in the beautiful seaside town of Eastbourne in Sussex. He was an introverted Irish doctor who seemed to have no qualms about accepting gifts and inheritances from his wealthy elderly patients. While not particularly renowned for his medical skills, Dr. Adams was known for his compassion and consideration, especially towards his elderly patients who trusted him. However, there were concerns about his methods, including his use of dangerous drugs and what some critics saw as an unhealthy interest in his patients' wills. Dr. Adams came under suspicion after the deaths of two of his patients. Edith Alice Morrell, who was paralyzed after a stroke, received a mixture of heroin and morphine from Adams to help with her symptoms. Despite adding a clause to her while stating that Adams would not receive anything, he still received some money, cutlery, and a Rolls-Royce after her death. Gertrude Hullett, another patient of Adams, fell ill and was unconscious, but Adams called a pathologist for an autopsy even though she was still alive. Hullett eventually died, and Adams recorded the cause of death as a brain hemorrhage, but an investigation concluded that she had committed suicide. Rumors began to circulate in the community about Adams, with some accusing him of preying on vulnerable widows, while others believed he was providing compassionate care. The death of Hullett brought Adams to the attention of the authorities. After hearing the town's gossip, the police finally decided to launch an investigation, leading to the arrest of Adams under suspicion of murder. The prevailing rumors in the refined seaside resort suggested that Adams, through his charming demeanor, would convince wealthy widows to write him into their wills before administering a deadly mixture of drugs. With accusations and hearsay reaching an alarming level, the local police had no choice but to initiate inquiries. Simultaneously, the media, almost conducting a trial by media, further solidified the belief that Adams, a general practitioner, had sinister intentions. One headline, "Inquiry into 400 Wills," undoubtedly contributed to the perception of Adams as a potential murderer. The police diligently investigated the case for several months in 1956. Then, on October 1st of that year, they confronted Dr. Adams with their suspicions regarding Mrs. Morrell's death. In his defense, Adams argued that his terminally ill patient, who was experiencing excruciating pain, desired to end their suffering. He contended that easing the agony of the terminally ill was not a crime. However, it was the legacies left in the patient's wills that kept the police suspicious of Adams' true motivations. Adams' trial occurred in March 1957, with QC Sir Frederick Geoffrey Lawrence defending him. Lawrence argued that the charges were primarily based on testimonies from the nurses who had cared for Mrs. Morrell. The nurses testified that Dr. Adams had a practice of administering excessive doses of pain-killing drugs to his patients, such as morphine and heroin. Despite being shocked and suspicious, the nurses felt powerless to intervene. However, during cross-examination, Lawrence revealed that all injections given to Mrs. Morrell had been carefully recorded in notebooks, along with details of her condition. These notebooks, overlooked by the police, contained every detail of Mrs. Morrell's treatment for several years. The nurses' verbal evidence did not align with their written notes, raising questions about their reliability. It was also noted that only one of the prosecution's medical experts claimed that murder had occurred. Furthermore, Lawrence demonstrated that this expert witness was not reliable. Due to Lawrence's defense strategy, Dr. Adams did not have to testify, and evidence from another case involving Gertrude Hullett was not allowed in court. A nurse from that case had allegedly made a remark to Adams implying his involvement in Hullett's death. On April 15, 1957, the jury found Adams not guilty after only 45 minutes of deliberation. Despite being found not guilty, the police continued to believe that Adams was responsible for not only 2 murders but also the deaths of numerous patients. This belief was shared by the press, with a journalist stating that Adams had allegedly killed many people and was likely to kill more in the future, leading the police to prosecute him even though their case was not fully prepared. Following the trial, Adams resigned from the National Health Service and was later convicted for forging prescriptions, resulting in him being removed from the medical register. Despite his tarnished reputation, Adams lived in Eastbourne until his death, with some still believing he had murdered at least 8 people while others, including his patients and friends, remained convinced of his innocence. In 1961, he was reinstated as a general practitioner, but he passed away on July 4, 1983, at the age of 84. At the time of his death, he had a fortune of PS 402,970 and had been receiving legacies until then.